Thank you for joining us today, Dr. Amjad. And this week we want to talk about colon cancer. So when is the best time to get screened?
Our recommendations are after the age of 50 should get screened for colon cancer. Unless you have a family history, then we screen earlier than that.
Means that you may actually have some problems.
Any change in bowel habits, whether you're going more or less, weight loss, abdominal pain, blood in your stool, those are alarming symptoms we start looking at.
What kind of questions should people be asking their doctor about colon cancer?
You want to ask when you want to be screened. Most family doctors go ahead and initiate that process when you turn 50. If you've had abnormal weight loss, a family history of colon cancer, abdominal pain when you're eating, those are things you need to bring up to your doctor right away.
And what does it involve in colon cancer screening?
So there are a couple things now. One is the traditional colonoscopy when you go in and they do a procedure. They also have a kit out there now that you've probably seen commercials. It's called Cologuard, where you can send that kit to your house and you send a sample of your stool in, and it looks for a DNA in your stool for signs of colon cancer. The best way is still a colonoscopy. A lot of people don't like it because it's invasive and going through the prep for it is miserable. But colonoscopy, the kit that insurance pays for now, those are the best ways.
And what is involved in treating colon cancer?
A couple things. So if the cancer is limited to a section of the colon, they can remove it. Then you have radiation, chemo. So surgery, chemo, radiation are what we do for treatment of colon cancer.
All right, thank you. And now we have a viewer question. Kenneth wants to know about asthmatic seizures. He says it is harder to breathe, like his heart is stopping in the process of breathing. So is that normal, and what should he do?
For Kenneth, that's a difficult thing to answer. If he's a bad asthmatic and he feels like his heart is not pumping properly, maybe his medications are not the way they should be, because, we usually use an inhaler or something when you're having an asthma attack. But if he feels like he's suffocating or his heart's not breathing, there might be something wrong with his medication, or you might have another diagnosis that's not just pure asthmatic. It might be something else. So he definitely needs to see his doctor right away and go over this.
All right. Well, thank you so much for joining us this week.
Thanks.
Ask the Doc is brought to you by these community-minded sponsors.
And if you have questions for the doc, just send us an email at news@wvnstv.com. We'll ask Dr. Amjad your question, and be sure to tune in here on 59 News at 10 every Friday evening to see if your questions were answered.